Okay, we're going to talk about how diathermy can be used to improve soft tissue extensibility. The goal of the treatment is to use thermal effects of diathermy in order to improve the extensibility of soft tissue. One of the main advantages of diathermy when using it to heat soft tissues is the fact that it can heat deeper tissues compared to other superficial modalities. The extent of the tissue heating is determined by three things, including the inverse square law, the magnitude of the applicator, as well as the type of tissue that we're targeting. For thermal effects with diathermy, we're looking at it to be above 38 watts of intensity, and the way that we calculate that is by determining the mean pulse power, and it's determined by the peak pulse power times the percentage on time. The peak pulse power is set on the machine in terms of watts, and then the percentage on time is calculated by taking the pulse duration divided by the pulse period, which is also set on the machine. During this treatment, we will also screen for contraindications and precautions. The contraindications include any type of metal implants, malignancy, any treatment over the eyes or testes, over acute injuries, or pregnancy. The precautions include the fact that diathermy should not be used near electronic or magnetic equipment. The modality should not be used on obese patients due to the fact that fat heats at a much more rapid rate. And finally, any copper-bearing contraceptive devices. And a final precaution is that female PTs who are pregnant should not perform this modality on the patients. All right, so we're going to perform continuous diathermy, producing a thermal effect on Logan's anterior thigh here to improve the extensibility. So you're going to need a towel. We're going to place the towel over the patient's anterior thigh just to soak up any moisture that might occur during the treatment. We're going to explain the treatment to the patient. So Logan, we're going to be using this device here to heat up your thigh, and then we're going to get you up and stretch you afterwards. This would be the time that we screen for any contraindications and precautions that I mentioned earlier. So if those are all clear, we'll set up the diathermy. We're going to set it to continuous on the machine, and then we're going to ignore the part where it asks about the pulse duration or the pulse period due to the fact that we're using a continuous method. Then we're going to set the time to about 20 minutes, and once we turn on the machine, we will set the intensity up to the point where Logan feels a warming sensation within the leg. And we want to make sure that it's not a burning sensation, just a small warming effect. So we'll turn on the machine for about 20 minutes, and after those 20 minutes are up, we will get Logan up and stretch out the tissue.